we decided, in working with the Eastern Band of Cherokee Indians Health and Medical Division and with Western Carolina Cherokee Studies and Educational Outreach Division, that we needed to have a session with the elders of the community who could share their ideas, traditions, and their perceptions about Cherokee health to all of the clinical providers that are here on the boundary.
Well, the Elders Council started out as an information gathering group to identify sacred sites on the Qualla boundary. But as tribal programs learned about the Elders Council, they brought other issues to them to help tribal programs culturally and traditionally.
That's what makes a nation of people, is the things that we have to offer and to give to each other. That's what makes us strong.
And I think, it's very well ensconced in the public health literature that there are these major health disparities. And of course, part of those health disparities have been attributed to cultural barriers, language barriers.
And I don't know if you can make it any more simple than you do. And if you can, it'd be in our best interest to do that. Yeah, you've got something wrong in your stomach. We're not really sure what it is, or there's something growing in your stomach. I think that describes to me a little bit about my problem better than if you use a term.
There are still a lot of Cherokees who are more comfortable expressing themselves in Cherokee. I feel like that if they don't express themselves in Cherokee where they're more comfortable, they're not really going to get their message to the provider at what's really going on with them. And of course it would be helpful if there was an interpreter that could interpret for both the provider and the patient.
Our verbs and nouns are exactly the opposite of English. Now, I don't know if it's English that's backwards or if it's Cherokee that's backwards, but they're different.
I think it's good for Western as the closest state university, largest university to our community to show interest and concern for the needs of our community. The huge new project is called Culture-Based Native Health Program. It's an online program that will assist service providers to Native Americans in general, but specifically the Cherokee community in receiving, it will assist the service providers in giving better care to the Native population. Western is involved in that. The Cherokee Center, which is what I represent, works closely with Dr. Lisa Leffler, the project coordinator, in trying to get advertising out to other Indian communities to see if they might be interested in this online curriculum. And Western's, of course, nursing program is outstanding, and reputation is wonderful.
It's important for healthcare providers to listen to the community. That way they are able to better understand their needs, better understand the cultural norms and mores that are associated with issues of health and wellness and getting better. And it's important that physicians stop and listen and try to, in instances, learn the language, understand the historic events that have impacted the community.
And they weren't comfortable. My daddy's generation mother, they still weren't comfortable. They had a lot of fear.
And we have just developed a chart of all the body parts in the Cherokee language. And a follow-up is listing all the diseases that's known to us and how they affect the body.
The nature of healing and the nature of the way the body works is a very sensitive thing to most Native Americans. And it's a knowledge that's based on science. It's not based on omens or superstitions or things like that. It's based on pure science. The foods that we ate, the way in which we did things was pure science.
I think it was a success. We had some positive feedback from some of the medical personnel here. We have interest from both the elders and the hospital and health and medical division, health professionals, in continuing this dialogue. And I think it will strengthen the relationships that physicians and nurses and counselors and other folks, I think that it will strengthen their relationships with the population here.